Hi, welcome to this edition of A Conversation With. I'm Jim Marshall of the New Bedford Cable Network, and joining us for a return visit, Cheryl Bartlett, the CEO of the Greater New Bedford Community Health Center. Thanks for joining us.
Oh, thank you.
It's been Cheryl's been on with us a couple of times talking about the pandemic is where we are, and it's hard to believe I think it's 20 months now.
Yeah, I know.
It's crazy when you really think how it seems short, but it's been a while that we've been dealing with this. As we're doing this show right now, we're heading into the fall season, and I know that throughout the summer and what have you, and in the spring, people were looking forward to kind of the fall, going back to work and going back to school and the new normal, if you will. But I'm curious, as we're taping right now, where do you think we stand right now with the pandemic overall?
Well, I would say right now we are where we were numbers-wise for positive cases, where we were last fall. And if you remember, last fall was sort of the beginning of an uprise and what I would probably call surge number 2. And so last fall we then went into the holidays, which got even worse because people disregarded public health advice not to congregate in groups that hadn't been together in a little bit of a bubble, as everyone calls it, during this time, and we saw huge spikes. And then we saw it kind of simmer down after the holidays and then the good weather again, people coming out, and now this new variant, the Delta variant, took hold in the U.S. About 90% of the cases now are this new variant. And so that seems to be going through the population, and right now still seems to be hanging in there at high numbers. So will it keep going up? A lot of different things to read that are out there in science and medical journals that some say these have cycles, these variants, where they go on for a few months and kind of burn themselves out when they don't find someone new in the population to infect, so to speak. But oftentimes from that spins out another variant that changes itself because of the way that these viruses live on, so to speak.
Has the and it's curious too when you talk about that because like I said, you've been in a couple of times now, and I remember you talking about the holidays at that time. But we were coming off the summer, and people felt better after those 3, maybe 4 months from May to maybe September when the weather was nicer and people were out. And it does seem as though cases during those times when people are outside, they do go down.
Yeah, way down. They say it's almost now. I mean, I think the first summer we didn't really know, right? If outside was a real problem. I think that I've read some places that you can almost say 0 chance of getting infected. Now that's outside, that's not all crunched in,
correct, yep,
screaming and singing at a concert or something like that. That's kind of normal outside activity. The risk is very small.
And and in some ways it's a false sense of security when you come out of those 4 months, I would say.
Yeah.
Is the virus, do you think, is it acting like a typical virus in that there's variants, and I mean it's just acting how a virus would act normally?
Yeah, I think from all I'm reading about it and experts kind of talking about it is that viruses reproduce very rapidly. And let's think about HIV. That's a virus, and that's a sort of pandemic that I liken a little bit to what's going on. And as it reproduces, it's copying itself. It doesn't copy itself exactly each time. A scientist described this so simply for me one day. Imagine if you took an original document and you made 1 copy. Pretty much it's the exact same copy. But you make 1,000 copies, look at the first one and the 1,000th one, you're going to see changes. You're going to see markings where there weren't markings, maybe fading of the ink, whatever. It's not identical. So once it's not identical, it can start to behave as almost like a new virus, which is what these different variants have done with this.
And it's curious too because in different parts of the world there are different variants too, and I would assume that's because of socio issues and climate and other things too. I mean, the virus just adapts to what it sees or what it has.
I think what they really are is they are this virus reproducing, making a new copy that isn't identical, and then it takes off and starts to infect people. And then when people look at it molecularly, they can see that it's not like the other viruses, and they're often named for the place they were first identified. So India got this new variant, and that's where they came up with the Delta variant, the UK variant. So it really is based on a population that's starting to enter a new virus that isn't exactly like the virus that was infecting the population.
It seems though, as we go into the fall, and like we were talking about, I know that people were optimistic that maybe in the fall things would change, kids going back to school, some businesses hope to get back to work, but that it doesn't seem like that's going to happen right now because of the Delta variant. Was that too overly optimistic, or?
Well, I think it was probably optimistic to think we wouldn't get the Delta variant to the degree that we did, watching what's happened in other countries. So probably, but at some point I feel like we have to start to make decisions hoping that we have all the tools to control it better. And I think we felt with vaccines, I think we thought more people would want them, right? And that's a big problem.
And the interesting thing, and I just want to touch on that and we can go back, but there was so much hope for the vaccine when before they were even or emergency released, everybody was talking about getting the vaccine. And then they were available, and it's kind of, I don't want to say it's lukewarm, but I mean, the country's only at what, 60%, I think, right now, fully vaccinated?
Yeah.
It's still a lot of people that aren't fully vaccinated, and people seemed excited before they were vaccines.
Yeah, I think that those were the vocal early adopters that we were lining up to get the vaccine, whereas there is probably, as we're seeing, I mean, New Bedford's less than 50%, so there are people that are really hesitant for many reasons. I think the recent final approval of the FDA for the Pfizer vaccine, actually we started to see a bump up in people coming in. There were people that felt that it hadn't been researched thoroughly like other drugs are. And so I think that there are people, I've heard, that hate needles so badly that they really, I know, really don't want to get it. And then there are people, I think there's fears about government, right? There's a lot that this is a government, and we heard a lot of that during the election, government politically engineered pandemic. Well, this is around the whole world, so I don't think we can control the whole world's politics. So a lot of reasons out there that keep the numbers low, which is allowing all these variants to take hold because there's hosts that are available to them. And we are seeing that over 90% or more, close to 97% in many cases of the hospitalizations are in unvaccinated people.
Obviously, you've been right in the center of this for the past 20 months or so right now. I would assume that you're seeing the same things when in your at the health center as well. People, the reluctancy or whatever, and you're trying to convince, your staff is trying to convince people to get it.
Yeah, sure. I have to say I'm proud of our staff. I think we're about 84% vaccinated, but I have some very strong hesitance. So I'm still trying the incentive approach to try to get them there. Our patient population is maybe about only 25% vaccinated. We send out robocalls, texts, all kinds of things to try to get people in there.
And you deal with a lot of people. I'm not talking just COVID. I mean, you have a lot of people coming in for health-related issues as well.
Yes.
Which is surprising that with all the people, and it's only gone up, the numbers for you guys have only gone up, that it's only 25% of people that are taking it.
Now I have to say maybe 20% of them are kids that don't qualify yet, under 12. We do have a large pediatric practice, but that still is quite a few of people that aren't getting vaccinated. And we serve about 24,000 people. They come in about 80,000 times in a year, so that's a lot of opportunities to vaccinate, and we're struggling.
Are you surprised though?
Not really.
No?
I mean, I hate to say, I know everybody with this one says, I'm really not an anti-vaxxer, but these are all the reasons why I'm not going to get the vaccine. And I think anti-vaxxers have developed a little bit of a foothold in the country. A lot of mothers don't want their kids getting childhood immunizations. And for me, I say those are people that I don't think have lived through the illness from these preventable childhood diseases. And as soon as somebody a lot of children in a neighborhood, let's say, got measles and got really sick and or had long-term consequences, these diseases are not without harm. They can be very harmful to people. So the reason our life expectancy in this country has risen to almost double what it was back in, let's say, my grandmother's day is immunizations and sanitation, community sanitation, refrigeration, standards for food, and
vaccinations have been around for quite a while, really.
Over 100 years, I think, is when.
Is it? Yeah.
About 100 years.
Because I know, I mean, as a kid, and I'm in my 50s, but as a kid, we had vaccinations for, I don't even know how many shots, but it seemed like there were a few before you could go to school.
Right.
And they're still there, I think, for schools, if I'm not mistaken.
Yes, they are required in most every state, I believe.
Right, yeah.
Yeah.
Measles.
And they're free. Massachusetts even removed any kind of financial barrier for vaccinations. But there are these groups of people that really don't believe in vaccination. There's still strong hold that autism is derived out of vaccinations, and there's science after science that really debunks that. And those things take hold, and we get our news today from social media that comes from whatever people think. They're putting it out in the world, and there isn't any fact-checking, as we know.
What's the biggest challenge that you and your staff have faced during this whole thing?
I would say the fatigue of the staff, right? They're working nonstop. For a while when the world was locked down, they couldn't even, there's no relief. You go home and you have the same stressors around this disease about protecting your family as you have as protecting our patients and caring for them at home. Whereas typically in a rough day at the office, or we've had a lot of sick people, you can go home and do something different, right? Go out with your family, go with your friends. Our whole lives have been turned upside down. And so people are having a hard time figuring out what to do to de-stress themselves, to bring some more fun and joy in the life. Because everywhere you turn, you're getting messages like, don't do this and don't do that, or put the mask back on, take the mask off. That's a lot of stuff to throw at people for the length of time. There becomes a epidemic and pandemic fatigue for people where they can't hear another "don't do this" message.
In your careers, you've done this for a long time. As you look at the health industry right now, and you're looking at nurses and doctors, and not just at your place, but in other places, you're right. It doesn't seem like there's a break, and you wonder, have they even had a weekend off? Have they had a vacation?
Right.
You're right. It just doesn't seem to be ending.
Right, because there's a risk. So people aren't taking vacations the way they used to because of the fears of what do you do that's safe, particularly if you have kids. A lot of my staff are young families with kids. So, yeah, they're just, it's a just never-ending stressor in our life. Turning off the news, I think I've said that repeatedly.
You said that twice, yeah.
I don't watch the news anymore. Almost not at all now, because between what's going on politically and what goes on around coronavirus, I don't want to hear about it.
Well, we're talking about your staff. What's been the thing that, I don't want to say surprised, but you're most pleased with throughout this whole thing?
I have to say that I've been here 4 years. I came in, there was a lot of transition that had happened before me, and I was trying to create a new culture and a new way of working together and more of a team and camaraderie spirit in the organization. And some days it didn't feel like we were getting there. And in the middle, well, actually when this first happened, what I saw was people snap together, figure it out, help each other out, and they're still doing that today. So it showed me a strength in the organization that will help us move forward into a future that hopefully COVID is only a small part of all the different things we do for the community and the population.
Well, you're talking to me off camera too. The interesting thing is, we as a society may have to get used to this just being around.
Right. The flu is around every year. We know the seasonality of it, when it happens, what to try to do to prevent it. So this will be another thing. but we'll be having to push the population to get it. It took us a long time to get people doing flu shots with any regularity.
Really?
And any number, yeah. Was a number that every year at the Department of Public Health we had to report to the governor and to the Public Health Council. Like, particularly they look at healthcare institution. What percent of the healthcare institution staff are vaccinated as sort of a marker for how many people are vaccinated in general, but also what the likelihood is hospitals and healthcare workers could be a transmission vehicle for
Right.
these diseases, because people have to come to hospitals and come to healthcare providers. So we need to get vaccinated. And then there's the question of, if you as a provider don't get vaccinated, what do you recommend to your patients? Are you really practicing the best medicine? Because
Practicing
you
what you
can't
preach.
really believe in it that wholeheartedly if you're not getting yourself vaccinated.
Right.
So
As we're looking at right now, I know that a lot of the businesses and whatever are requiring vaccines in order to go back to work. I know the city is looking at the policy right now to look at that. Your thoughts on that?
I think that we have seen a spike in people getting vaccinated this week. We were down to getting 30 to 50 people a day maybe, and this week we're getting over 100 again. And so a lot of people are saying that in order to go back to work, in order to have more flexibility in what they do in their lives, they're more and more running into circumstances that if they're not vaccinated, they can't do those things. So that is helpful, very helpful.
In private businesses too, you think, or a good thing
Yep.
to do that? We're talking with Cheryl Bartlett. She is the CEO of the Greater New Bedford Community Health Center. She's been with us pretty much with us throughout this whole thing, and I appreciate that. Mask mandates, I know, are coming back too in some ways. Good idea, bad idea? Especially inside. I know outside they're not.
Yeah.
There's no mandate for folks outside, but inside, if you're going into places, I know they're requiring them.
Yes, and I think we saw clearly that masks help. The two big things, masks and vaccines, are the things that will get us out of this going into the future. And I think masks may be something that some of the Asian countries use masks all the time, well before COVID even existed, because we know that there are things in the air. So thinking about the environment you're in and what the risks are, like planes, there's a lot of bad air that gets circulated in planes. So if there are bacteria or viruses in that, regardless of COVID, I know when I go on a plane, I always get some kind of a cold after I get to where I'm going, because I've been exposed to whatever's circulating. So I think we saw very little flu last year because people had masks
and that's curious
on.
too. You're right, because we talked, the flu season was not bad at all compared to normal flu seasons.
Right.
So what do you attribute that to, It almost makes sense that, the mask has a huge impact on that.
I've heard people also saying allergies. People that have allergies had less of them, particularly in the allergy season. So there's some doctors suggesting we should start to adopt these kinds of practices more regularly, because we'll be healthier for other reasons. So masks with flu, masks with allergies, masks indoors, I think. And to me, hopefully we as a society can start to judge where we are, and does that setting require masks or not?
Well, the only thing that I think is curious is, so you go into a restaurant and you have the mask, but when you eat, you don't wear the mask. And it's kind of like, okay, but are you really helping yourself by not wearing the mask when you're eating? Obviously, you can't wear a mask when you eat, but so how's it helping if you're taking it off?
Well, I think that that's where there's two sides of the story, right? There are people that don't think we should be letting people eat in restaurants, and there are people that think they should.
And still restaurants are doing takeout, just takeout only.
Yeah. And some I've been in, they're still kept the social distancing. Others have crushed right back into where they were. I think, I know I'm wiser. I go out to dinner once a week, and I've done pretty much throughout it, except for during the lockdown, but I'm smart about it. I actually go a little later. Now 7:30 is considered late at a restaurant.
Yeah.
And there aren't as many people there. Sometimes there's only one or two tables left, so I feel like I'm in a more open environment, and I only have one or two places I go. I know the people, I know their level of cleanliness, so I think more caution is really important for where we're going, the settings we're in.
Talk about, and I know one of the things I wanted to talk about was the booster shots. That I know that right now, my understanding, and correct me if I'm wrong, it's people who have pre-existing conditions, elderly. Those are the folks right now that are looking at taking the booster shots. And I assume that makes sense, really.
Yes. So I think this is where I'm thinking the government has to think before it kind of puts the message out into the media, because they first said that the immunocompromised and people with multiple different chronic diseases should get the booster shot because they never maybe got the level of immunity that others did from 2 shots.
From a non-doctor standpoint, that seems to make sense to a layman like me.
Yes, it does, absolutely. But then they said very quickly after that all people should just get it. If you were, first it was 8 months after your second shot, then it was 6 months after, then it was 5 months after. Then yesterday I read, we shouldn't have said that. We probably should just let the immunocompromised. And those are the things that make me kind of squeam a little bit, because I'm thinking, that's so confusing. I'm having a hard time deciding,
Right.
what I'm going to do. And there's all these people out there that should I get the booster? Should I not get the booster? Right now, they are saying that it hasn't been approved yet for the general population, but those who have these other concerns should get vaccinated.
When you hear about the breakthrough cases, the one thing that stands out to me is that's not a surprise, because they're not 100%. None of the shots, the vaccines, are 100% preventable for the illness.
Right.
So, but the vaccines are still effective in really saving your life and getting seriously ill.
Right. So I think, again, that is confusing. I think we haven't really had anything that we've had to deal with like this for a while, so I don't think people realize that vaccines aren't 100%, right?
Right.
I think these 2 vaccines are about 94 point something percent effective, Pfizer and Moderna. So there's still 5% of a population that can get these things. And some people will have waning immunity, so you'll have some breakthrough. But the idea is that your body is prepared enough because it's been exposed to the virus through the vaccination or through the mechanism the virus works, and has helped your body to create a response to our defense system, our white blood cells and everything. They come rushing to aid us and take away things that don't belong in our body. And so it only happens when it learns how to recognize those things when they're in your body, and that's what a vaccine does. And that's what natural immunity does. You have the condition, you recognize the microorganism, and your body responds to take care of it.
I was curious too, because kind of what we talked about when you were talking about the efficacy of it. I mean, the flu shots aren't 100% either. And
Right.
yet
Right.
we still
Shingles.
get them every year.
Shingles shots, the first shingles shot was 50% effective. Now I think it's up to 80%. So yeah, we perfect these things over time to the ability that we can, but science doesn't prevent morbidity and mortality.
Right, right. And the thing with the flu shot too, it's sort of the same message: is it may not prevent the flu, but the seriousness of the illness will
Right.
be limited if you get the flu shot.
Right. If you look at some of the national numbers, and I know it's been similar in the region, that over 90%, and I think I said it earlier, but saying it again to emphasize, of people in the hospital, in the ICU, on a ventilator, are people that are not vaccinated.
Right. What is the biggest misconception of the vaccines that you've heard that you think should be said to people about them? I mean, there's a lot that goes around about the
Yeah.
vaccines, but what's the biggest one that you think is just, it's just not true, and you're never going to convince people to get it, but at least
Right.
one thing that you think?
That it hadn't been studied long enough, because coronavirus has only been here, as we said, 20 months, right? So I think people think this got found somewhere in a science lab and said, okay, this is the vaccine for COVID, here we go, let's get it out the door. This methodology of vaccination has been studied for 20 years. They've been kind of studying it, looking for something to treat with this
Really?
particular,
Okay.
yeah, they looked at it for other kinds of coronaviruses, right? SARS, MERS, different coronaviruses. They've studied this the messenger RNA that's Pfizer and Moderna. So the method has been studied for a very long time, so we know it's safe. There isn't a safety issue whatsoever. And even before we began giving it out here, over 30,000 people went through a safety trial. So safety is definitely not an issue.
And I think you made a great point when, I think people think that coronavirus is just this new thing, but as you mentioned, there's other coronaviruses that healthcare people have been dealing with for years.
Right. This is coronavirus. We call it COVID-19 because it's coronavirus in the year 2019 is when it started.
Right.
So there are, and that Wuhan lab, they had all different strains of coronavirus.
We got a couple minutes left. I wanted to, I know you guys have been dealing with this. I asked Damone Chaplin, who I know you've been working with closely. There are so many issues that I know that you deal with other than COVID. Mm-hmm. Has that hurt your ability, the organization's ability to treat other issues that you're passionate about or trying to emphasize?
No, not at all. In fact, I think it's the silver lining is it's given us new tools to maybe even have better connections with our patients. The fact that we have telehealth now and it's here to stay, that wasn't something that insurers would pay for in the past, and so we never really learned how to use it. And for some visits, like checking up on someone, did you start your new medication instead of making them come back in? So we're able to see people, we're getting more people wanting behavioral health by telehealth because it's more personal and private. You're in your home, they're in a private office, you don't have to come into the health center.
Do you find people are still going? Because I've read and seen that people aren't, because they were worried about going to healthcare facilities because of COVID. So they're not, some people may have a heart attack and they're not getting treated, and some people have other issues that they're not getting treated. What do you tell those folks?
That is a problem, and that was a problem. And in the beginning, we sort of created the problem by saying there's nothing elective, we're not doing this, we're not doing that, stay home, call us. So that is a hard problem to solve.
Okay,
We're still down the number of visits we would typically see in a year. So I'm actually at a place where I'm looking at getting more community health workers who do outreach and go out into the community and talk to people in different groups or different activities going on, make a presence, and try to get people who are our patients to re-engage if they need to, and for people who aren't engaged in healthcare at all to try to come in and enroll them in the health center. So yes, we have to make sure, but we're doing both in parallel track. A lot of what the clinical staff were doing was mainly focused on COVID and really other acute clinical conditions that needed to be addressed, but our administrative team has been very busy planning for what is life going to really look like after COVID, because we won't ever go back to the level of activity or workflow or protocols the way we used to be. So we need to come out of this with a whole new way of doing business. And so in parallel to the day-to-day clinical, I've created a new organizational leadership structure to help us come out the other side of this.
It's good seeing you again.
You too.
Thanks for coming in. Thanks for keeping us updated on this.
Thanks. Thanks for keeping the community informed.
Cheryl Bartlett, she's the CEO of the Greater New Bedford Community Health Center. Again, she's come on a couple of times, and we appreciate her just keeping us updated. That's going to do it for this edition of A Conversation With. I'm Jim Marshall, and we will talk to you again soon.